This webinar is made possible by the Sentio Marriage and Family Therapy Program. Visit us at www.sentio.org. So welcome everyone to this webinar on deliberate practice for psychodynamic therapy. Today's episode, Deepening Emotional Experience. At this point, it feels like a Netflix series. We are
Yes.
very happy to have a recurring,
Totally.
the pleasure of recurring meeting here with Hannah. So my name is Alex Vash. I'm with my colleague Tony, and I'm going to briefly present our wonderful guest expert, Hannah Levinson, who has already done a number of these deliberate practice webinars with us. Hannah is a professor at the Wright Institute in Berkeley, California. She has specialized in brief dynamic therapy and supervision for over 40 years. She has authored over 85 professional papers, 4 books, released professional videos with APA illustrating her approach. And also, you should also include in your bio, Hannah, that now you are a deliberate practice expert, I should say, because Hannah now actually has observed so much deliberate practice work that she can explain better than myself and Tony what we do. So thank you for being here, Hannah.
Totally my pleasure.
Tony, you want to take it away?
Yes. We are with the Sentio Marriage and Family graduate program. That is a new graduate program that fully integrates deliberate practice from the ground up in every class. We are opening in California, so if you know anyone looking for a master's degree in MFT in California, send them our way. Thanks, Alex.
Wonderful. All right, let's jump into today's topic. And some of you may have, I recognize some names. Some of you have already heard the deliberate practice rant. So I'll keep it very, very brief. In deliberate practice, we always like to start by making this distinction between conceptual learning or conceptual knowledge and procedural learning, procedural knowledge. So conceptual learning, meaning the types of learning that you do through reflecting. So you may read books about psychodynamic theory, for example. You might talk with peers about it. You might go to supervision and talk about your cases. And all of that is, of course, fundamental to become an expert clinician, for example, the conceptual knowledge, the conceptual learning. However, in our field, we tend to not have a lot of procedural learning, which is also, we believe, necessary to develop expertise. So procedural learning means learning by doing. You can see the image there of the person playing the piano. So it's one thing to read about the piano, totally different thing to actually play the damn thing and actually be able to get better over and over time by actually doing it. And we believe that psychotherapy is somewhat of a performance skill. Not just, it includes a lot of conceptual knowledge as well, but you also need procedural skills in order to do it. So we believe that doing deliberate practice skill building exercises along with the conceptual learning will be necessary to become an expert. I should also mention a personal anecdote. Hannah, this is a new one because I know you've heard this rant a lot of times already. That just this weekend, I was trying to show a colleague of mine, a friend of mine, a guitar piece I had composed 10 years ago and realized I can't play my own piece I composed 10 years ago because I have stopped practicing the guitar. And so this is a cautionary tale for all of us practicing any skill that if you don't use it, you lose it. You may practice this psychodynamic skill we're about to practice today for a while, but unfortunately, chances are you're going to need to keep practicing over your lifetime in order to keep developing and not lose your skills over time. So just a personal anecdote there. So Tony and myself have been editing this book series for the American Psychological Association. Each book has 10 to 12 skill building exercises for each of these psychotherapy models. These are not all the books, actually. We just came out with a psychedelic assisted therapy book, I believe this week or last week. So a lot is happening. And today we'll focus on the book there on the left, Deliberate Practice in Psychodynamic Psychotherapy, offered by our dear Hannah Levinson and also Volnigay and Jeffrey Binder, who had the very, very difficult task of coming up with 12 skill building exercises for the immense history that is psychodynamic psychotherapy. And so these are the 12 skill building exercises that Hannah and her colleagues developed. We have already done 2 webinars focused on the first and the second exercise on the book. And today we are focusing on the third deliberate practice exercise in Hannah's book called Deepening Emotional Experience. And Hannah, I'll slow down here and kind of pass the ball to you. Do you want to say a few words in general? How are you doing, first of all? And any words on the skill we'll focus on today?
Yeah, I am very excited today. I have to tell you this. I know I probably shouldn't have favorites, but this is actually, I think, my most favorite skill, or I should say, collection of skills that come under a general umbrella of deepening emotional experience. The ability to invite someone into their own experience, to help them express their emotions, to find meaning in those emotions, is an extraordinary experience for the therapist to be able to capture that and do that at a specific point in time in the sessions. You know, if I were relegated to take one skill with me you know, into doing therapy, it would be the skill of really deepening emotional experience. And the research on this skill is enormous now and really indicates that rivaling the therapeutic alliance, and I think between you and me having a lot to do with the therapeutic alliance, is really one of the most strongly associated skills to outcome. So if you can get this skill under your belt and develop this skill over time, I think you will see an amazing improvement in your therapeutic outcomes.
And I know we have a lot of people from a lot of different countries, so I don't know how it is in Croatia or Sweden, but I know here in Portugal where I am and in the US where Hannah is, a lot of clients need help getting in touch with their feelings. I don't know about other countries. In our country, that is certainly a necessity.
Oh, really? I had all these stereotypes about Lisbon, but okay.
So here's the thing. When we look at these skills, the common question, of course, becomes how do you decompose such a complex skill into a practicable, a trainable micro skill? And I would imagine a lot of people are looking at the title Deepening Emotional Experience and wondering how would that be a practicable skill? And so this is somewhat of a slightly different exercise than ones we have covered so far, because you're giving the therapist free options. For any client statement, the therapist has free options in order to deepen the client's emotional experience. You want to say a few words about this, Anna?
Sure. And also, as that first statement says, you're not confined to one. You can use one or more. And in fact, practically speaking, we do find that option one, which I'll talk about, it kind of infiltrates into other options as well. So let me go through them. So to intensify the most poignant feeling and meaning embedded within the patient's statement, using vivid language, matching your tone of voice and manner to the patient's underlying emotion. And let me say a bit about that underlying emotion. It might not be the emotion that's floating on the superficial top, right? It might be an experience that is very much deep down. And this is where the therapist must be an emotional detective, a midwife, you know, whatever metaphors you want to use here, to be able to see that underlying emotion and help give it birth, help bring it to life. So vivid emotion, matching the tone of voice, trying to get what is underneath. Option 2, using an I statement, spoken as if it's from the patient's point of view. And in psychodynamic psychotherapy, we call this kind of being as if, right? So once you use an I statement, kind of owning what the patient is saying, but it is now being embodied in you, coming out of your mouth, really seeds that deep emotional experience for the client. And then option 3, use a metaphor or analogy. This kind of speaks to more the right hemisphere rather than that linear left hemisphere. This really begins to open things up in terms of rich imagery. So, and I love metaphors. And in fact, we have a whole exercise on use of metaphor, a whole skill exercise on use of metaphor. But here we're attaching it to these 3 options.
And so what's interesting about this exercise is, like you were saying, Hannah, for each patient statement, the therapist can really use any of these options or mix between them.
Right.
So let's give people a taste of what that looks like. So let's imagine, and again, in all our deliberate practice exercises, we provide scripted patient statements, kind of your starting point. And then the task is for the therapist to try to improvise a response, a therapist response that meets that criteria. In this case, people have different options to meet the criteria. So let's imagine that the patient says, I would like my mother to listen to me. Following the options that Hannah just enumerated, the therapist might say, for example, you'd like to grab her by the shoulders and force her to listen. So that would be one option for option 1, using vivid language, matching the tone of voice, right? Really bringing out emotionally what the client had just said. So that's one option. But the therapist could also say, Mother, I need you to listen to me right now, which would be fulfilling the second option. The therapist would be using an I statement, speaking as if they are the patient, right? And also, I don't know if you agree, Hannah, this is more of a mix between options 1 and 2. It's the I statement mixed with the vivid language.
It often is.
Right. Or option 3, therapists could say, her listening to you would take 50 pounds off your shoulders. And so this is a therapist using a metaphor or an analogy. So all of these would be correct because really the underlying principle is you're trying to do something to deepen the client's emotional experience, right? Would it be fair, Hannah, that all of these are aiming at the same goal in a sense?
Yes, absolutely. Different facets, same goal.
Right. As we often say in the little practice, if we have plenty of options, what you'll probably find is that you, the trainee or the person practicing, will probably be more comfortable with one option versus the other. So as we're practicing, you can start with your comfort zone, but it's going to be interesting if you can then branch out into the other options that you might not feel so comfortable with. For example, maybe using metaphors is not your particular thing, but it might be a great thing to practice. How could I use a metaphor or analogy to meet this client where they're at? Right? This is what the Lord practice helps, is you have this experimental quality to it. So, Hannah, anything you'd like to say before we jump into actually trying it?
Yeah, like let's just imagine you've got a patient and they say, I would like my mother to listen to me, right? And then you could come back and you say, well, how do you feel about that? Right?
Thank you, Donna.
And that is a very common way that many psychodynamic therapists try and get into the affect. But certainly you can see the difference when you ask, how do you feel about that? You're really asking for information, well, tell me a feeling. And patients will comply. They know what they're feeling, even if it's at a superficial level quite often. So they'll comply and they'll give you that information, but that is not going to really deepen the emotion. That is really not going to help vitalize the individual or transform the meaning making they can have with regard to that emotion, right? So you can see in contrast to asking a more, linear, informationally based question, and how do you feel about that? The difference here with the vibrancy of these options.
And Hannah, can I ask you just to briefly speak to what's the rationale for the therapist trying to deepen the experience rather than just get more information?
Right. Well, this is everything we know about emotion, the way it informs us, the way it vitalizes us, the way it actually shifts our worldview of self and other. These are all the things that psychodynamic psychotherapy is trying to achieve. Right. These are our goals. This is what we want to accomplish. And so ways of enlivening that, enriching that through the emotions, then leads to much better progress and outcome. So for a psychodynamic psychotherapist, these are invaluable skills.
These are really important. And is this a skill that would be used at a certain point in therapy, or is it more broad, or what?
This is one of those skills that when, ever the situation presents itself, that you think I could really use it. And it could be something very simple as the person walks in the door and they say something, but they say it with a flatness, or they say it with a certain tone, or you get the sense that they're looking at you for some kind of approval before they can even have any emotion attached to it. All of those, right from the get-go, you can open up.
Great. So this is a pretty basic but important and not necessarily easy skill that can be used across a very wide range of situations in treatment.
Absolutely. Absolutely.
Okay.
And I'll say it's very self-reinforcing when you use this skill, because you can see change often right away. There were some skills we use and it's like using it over and over and over, the water dripping on the stone, and eventually you'll see some indentation. But here you can really achieve change. You can really see the person opening up so much quicker.
Great. Great. Let's try it.
Yeah, we like to practice what we preach, so we always like to encourage attendees, if you're willing to do so. We're going to present a new patient statement. And for those of you who want, feel free to write on the Zoom chat a response that meets one or more of the options you have here in the criteria. Okay. And we have a guest expert here with us, so Hannah will then provide feedback.
Let me clarify too, Alex. The way the exercises are meant to be used out of the book is they're meant to be done verbally with a pair of therapists or trainees kind of going back and forth and a supervisor or coach providing feedback. That doesn't work in the webinar format. So for the webinars, we do typed answers. And so I wanted to clarify that.
Thank you, Tony.
Yeah.
Helpful. So let's imagine that the patient says, I drive for 2 hours to see my boyfriend every weekend. Once in a while, it would be nice for him to come and see me. So, dear attendees, if you want, try writing on the Zoom chat a response for this patient statement using one of the options.
Okay, here's some. Can I read them to you, Hannah?
Sure.
Okay, so first one. It's like you're on an island wondering, will he come for me?
Whoa. I like it. I was having a whole emotional response to that. Yeah, wonderful. Using the metaphor and then being on an island stranded. I mean, there's so many possibilities there where the patient could go. Wonderful.
Great. Here's another one. I'd really love him to make the same level of effort I make to get to spend time with me.
Right, right. So here you're speaking from the patient's point of view. I'd really like him. And I could imagine the person who wrote it would be saying that with an emotion, you know, maybe a pleading or an irritated, or there would be some affect attached to that I statement that would then also help transform that emotion for the patient. Lovely.
Yeah, and thank you, Hannah. That really speaks to the value of rehearsing or practicing verbally,
Yeah.
because that's typically how we do therapy, is verbally, and so you get to work with your tone of voice and your voice pacing, and it's quite different than typing, right?
Yes. And I think the thing that prompted that, Tony, was when you read it, it sounded flat.
Yeah, that's,
And then I thought probably the person who wrote it had a little more oomph.
Yeah, I'm not well trained as a teleprompter reader. Here, let's try another one. I need to feel that you are as invested in this relationship as I am.
Yeah. I need to feel that you are right. So again, using those I statements. I love the practice of the I statements because I don't think we do that enough in psychodynamic psychotherapy.
Great. Let's see. I want my boyfriend to really prioritize me, at least some of the time. This is a yearning.
Right, right. Again, the I statement and the yearning. Yeah, combined, the vividness of it. Excellent.
Great. Here's another one. I wish you could care about me as much as I care about you. We're getting a lot of I statements.
Yeah, I love it. I wish you could care about me as much as I care about you. Yeah, I could imagine that being very impactful, right? Because it just says it so concisely, right? And right up front. Love it.
Great. And here's the last one. Let's then do another one. 2 hours times 52 weeks. I don't want to do the math.
Wonderful, wonderful. So we have the I statement, but here, rather than the longing, you know, we have the exasperation, we have the anger, we have that force. And this actually comes from a real patient. And one of the goals for her in the psychodynamic psychotherapy was to own, you know, what she wanted, what she needed. And so this would fit with her perfectly.
Great.
Right. I'm noticing, Hannah, based on your feedback, although option one explicitly talks about vivid language and matching the tone of voice, it sounds like for this particular exercise, the use of vividness and the expressive tone of voice seems fundamental across all these options.
It does, and attunement is paramount. So what do I mean by that? I mean, I wouldn't take someone who's just describing something very minimally, maybe not even expressing an emotion per se, you know, maybe a physical feeling. It's not even very personal. I wouldn't go from there all the way over here, you know, to full-blown, vivid, exasperated, all the kinds of things we're seeing here. So again, there's a matching. There's a matching. Where is the patient? And can I take them a few steps beyond that, but not say something so out of their experience that they're going to get scared or avoidant?
Yeah, yeah. Let's see, we have a example therapist response here from the books. For this particular patient statement, for example, the therapist could say, I drive to see my partner every weekend. Just once, I'd like him to make the effort to come see me. Henny, you want to comment on this example response?
Well, actually, that's what I said to the patient. This is from a video that was done of a therapy I did for APA. And when the patient said this, I said, you know, I drive to see my partner every weekend, just once. I'd like him to make the effort to come see me. And that really enabled her there to get more in touch with the anger behind what she was saying, rather than this confusion.
Great. Let's try a different patient statement.
And
so, Tony.
in 1 second, Alex, let's go ahead to the next one, please. And since people seem to really get the hang of the I statements, what I would challenge folks to do is, instead of the I statement, pick option 1 or 3. Because with deliberate practice, what we're trying to do is push like a little beyond our comfort zone, a little beyond our skill level. So it's not required, but just consider that.
Great.
Thank you, Tony.
All right, so let's imagine patient tearfully says, I just feel so upset. I can't stop crying. All right. Let's give people a minute to try a response for this one.
Here's one here. You just feel like you're losing it.
Yeah, I could see said in a tone that came close to where she was being tearful, right? That could really help her get in touch with her anxiety, you know, her worry behind the crying and the crying, right? That she couldn't hold herself together. So if you wanted to help her get more in touch with her worry and anxiety about that, then I think that could be helpful.
Great. Here's another one. It's like the tears will last forever and ever and ever.
Right, right. So it's kind of getting at the same idea. You feel like you're losing it. But here with the metaphor of lasting forever, well, it's not even a metaphor. Again, it's getting back to her anxiety. But drag, I really appreciate the prompts with how it should be said. Thank you. A quiet tone and drag out the last few words. So let me try it out. It's like the tears will last forever and ever and ever. Yeah. Yeah. Oof. Yeah. That really, I think, would really help both deepen her sense of loss, but also her fear about what would be the fear if she really got in touch with those feelings. Yeah.
Here's another one. It's like the dam has burst and you can't hold your tears in anymore.
Yeah, now there's that metaphor, right? The dam is burst, and you can just imagine her experiencing that and the flood that it would open. And then you might get, instead of more, which was a kind of weeping on her part, you might actually get some deep sobbing. And that would be a good thing. You know, I'm like, oh dear, now we've taken her and made her sob. No, that would really help enable her to see the pain underneath, right? To really engage with that pain. In other words, it helps us as therapists help the patient see the cost, the downside of what's happening, you know, for her. Yeah. In behaving in this way. Yeah. Lovely.
The tears are like rain in the fall. The rain just keeps coming and coming.
Same idea. Same idea. Now we've got the the coming and coming, which might even be suggestive, while also commenting on a fear about that. But the rain and the fall, you know, as the metaphor, you know, has another bit of imagery to it, which doesn't sound so frightening. It sounds, you know, somewhat nurturing, watering.
Mhm.
Yeah, interesting.
I would just point out something because we're seeing so many great responses. Uh, I also want to encourage as we're practicing this, attendees practicing this, to imagine doing such a skill with a client with whom you might normally feel anxious or struggling with. Part of the reason why we practice these skills is to actually be able to do them almost more spontaneously, especially with those clients we might get stuck with. So of course, it's one thing to write on a Zoom chat to a scripted response, and it's an important first step. It's like learning to play the piano scales, but really the ultimate goal here is to internalize so that you can actually use with your hard clients, right? And that jump can be very hard, wouldn't you say, Hannah?
Yes, and this is why, again, going back to Tony's remark about this is why it's important to say it out loud. You know, in our minds, it all sounds so eloquent and lovely, and then it comes out of your mouth, and it's like it didn't quite work the way I wanted. I would like to point one other thing out also, which is the variety of the responses here. They are so rich, right? And I can begin to see, if I could imagine, knowing the people behind the statement, that there's something about you owning it. There's something about this is your style. You know, this is going to feel comfortable for you. And I think that is a very, I'll take this opportunity just to say something very important about deliberate practice and psychodynamic psychotherapy, right? Because so many times, colleagues might say, yeah, but in psychodynamic psychotherapy, you're doing this deliberate practice and you're going to make people into little automatons and you're going to make therapists CBTers and, you know, this is what's going, and yet here we have the individuality, the authenticity, the complexity, right, of each therapist saying it in their own way. So I think that's the beauty of deliberate practice. At first, it might sound a little clunky. You're meeting the, you know, criteria, and then you start owning it, and it becomes you, and it becomes yours. So I have not found deliberate practice at all in my practice, in my supervision, to come out in some kind of robotic form.
Yeah, thank you for mentioning that, Hannah, because that is one of the concerns around deliberate practice, particularly deliberate practice of psychodynamic psychotherapy, and just the rich texture and nuance of the responses we're seeing today really point to quite the opposite. Here's one more, and maybe we can then do a different one. Are the tears an expression of sadness, or are they a curtain that covers other feelings?
All right, so this person has taken it beyond making a statement and making it a question, but there's no reason questions can't deepen, right, the experience of the emotion. So here, are they expression of sadness, or are they a curtain that covers other feelings, right? So the sadness could be relating to the person right there, where the, you know, meeting them where they are, right? And then using this lovely metaphor, right? Are they a curtain, as lovely as the tears are and as authentic an expression as they are, could they be covering other feelings, dear patient, right? So that I think is very nuanced and lovely. Mm-hmm.
So it's okay to kind of package this, so to speak, in a question.
Absolutely, and this question with the two parts is almost bordering on an interpretation, right? A suggestion, right? Maybe there's something underneath the tears. Maybe there's something really important here underneath the tears. But with the curtain and covering, it's all said so gently and invitingly that I could see the patient, particularly this patient I have in mind, taking a step further down that road. Yeah, lovely.
Great.
Right. So again, for each dual practice exercise in Hannah's book and her colleagues, there are 15 patient statements such as this, and there are 15 example therapist responses for each of those patient statements. So if you get lost, you can go see what the authors wrote as a suggested response. It's just one example. So for this case, patient says, I just feel so upset, I can't stop crying. Therapist could also say, if those tears could talk, what would they say? And you want to say a little word about this, Hannah?
Yeah, again, that's verbatim what I said. So writing some of these exercises were seemingly easy, but then trying to figure out what was I trying to achieve here and what exercise skill would it match? Yes, option number one, because I am using vivid language. And then, of course, the metaphor, right? If the tears could talk, what would they say? So now I'm kind of distancing a bit, right? And just having the tears speak because they have a wisdom. And that's one of the other things that's so marvelous about this, this skill is that emotion should inform us about what is going on. And the tears are going to inform her as to what is going on. I might just say, if it's okay, just before we leave this one, I was thinking about it just this morning about what if the client hadn't said, I just feel so upset. And she just said, I can't stop crying. Now, of course, you'd need to know the context, but let's say that's all she knows about herself, right? I just can't stop crying. She hasn't said anything about a feeling, right? There's nothing that really indicates a feeling here. She just is complaining, worried about having this behavior of not stopping crying. Then, as the therapist, could you imagine saying something that might help her have a feeling, or at least be curious about a feeling, or even embrace a feeling, right? So this is where you could use this skill, no matter what the level of emotional experiencing or processing the client is in. I just wanted to sneak that in there.
So this skill is appropriate even for clients who might not be comfortable, with a deep level of affect, or who might even be who might have trouble accessing a deep level of affect, or might not know how to communicate affect clearly.
Exactly. All of the above. Right. Right. So it's a very useful skill for clients who come in and they're really talking on very concrete levels, right? Very externalized levels. How am I going to get them to drop down into something affective that we could use in a psychodynamic psychotherapy?
Right.
Let's try one last patient statement here.
Right.
So we have a patient saying, please call me professor, not Mr. if you don't mind. Very different flavor to this one. So yeah, let's give attendees a minute. What could you answer to this client? People call me professor, not Mr. if you don't mind.
Here's one, Hannah. Hard work does beg to be acknowledged.
That's wonderful. Yes, I could see said with the right tone. This man could be very well understood. He would feel met, and I like the vivid language.
Here's another. Don't diminish me. I demand your respect.
Yes, yes. Now here's an I statement that hits the nail, speaking of metaphors, right on the head, right? This is the message, of course, to the therapist. And here you're indicating you get it, but now in the patient's own voice, and maybe even one-upping it, right? I demand your respect. So I think this could accomplish many things. It would certainly help the patient feel understood and could deepen that response, feeling like the therapist got him, right? So I think that could work very well.
Great. Here's another. You've worked for years to be respected in your field.
Right, right. And said with that kind of agreement, support, understanding, right? I think that could also be very successful. Yeah.
Here's a similar one. You've worked very hard to achieve your professional standing, and it's so important to your identity. Oh, sorry, I should have said that slow and gentle. Let me try again. You've worked very hard to achieve your professional standing, and it's so important for your identity.
Yeah, now I'll tell you why I like this one. It's taking where the person is, and instead of deepening that aspect, which the others do, right? Deepening that aspect, you've worked hard, you're indignant, I get it. Now it's just turning it slightly, and it's so important for your identity, right? So look at how lovely that pivoted, right? Taking it from here, worked hard, you're indignant, and I'm going to let you know I get that it's so important for who you are, right? And I could see that now switching rather than deepening the indignant, feeling. I could see that very much softening it and switching the conversation to what it means for his well-being. Yeah, lovely.
Great. We should start wrapping up. I'd just like to highlight how different this last client statement is compared to the previous ones. And that's part of the goal of the book. And I think Hannah and your team did a great job on this, is providing a wide variety of what we call client stimuli or statements. And I noticed there was a bit more of a hesitation, or it took a little longer for people to respond to this one. And I know a lot of therapists, myself included, feel a little more comfortable with sadness than the feelings that are being expressed in this statement, which are a bit more antagonistic or push back. And so one of our goals is to give therapists, trainees an opportunity to try these skills with different emotional contexts. And Hannah, can you speak a bit to that?
Yes. In fact, one of the ways that the psychodynamic book and approach with deliberate practice is different maybe from some of the others, is that one size does not fit all. So it became hard to practice, given that there were the client statements, and then you were supposed to give a response, and a client statement and give a response. And yet, how are we going to enable the therapist to practice, the trainee to practice doing this, understanding the dynamics of each case? So at the beginning of the book, this is just exercise number 3, we did have it statement, practice, but then we started developing characters for the book. And in fact, Alex, when you said, oh, here's a very different patient, with the man who said, call me professor, not Mr. He became one of the characters that we develop in the 12 exercises that the students can respond to, knowing that patient's dynamics. So now we can have a responsiveness that gets built into the deliberate practice, right? And then another character and so forth. And so this is a way we could make the book, I think, a little more sophisticated.
Let's
Great.
just add one more thing that, of course, in the book itself, you can practice with a colleague or by yourself with the scripted patient statements. Another benefit of knowing the skill criteria, these statements of how to do the skill, is you can also use them for your cases, either for self-supervision or in the context of supervision. I know in our counseling center, some of our supervisors have actually used some of these exercises with real
Yeah.
patients. Meaning, if you have a recording of a real patient, let's imagine you have a video recording of a patient, you could ask, how could I use this exercise with this specific patient? How would I now use this skill in this context? And that can bring the exercise to a whole other level because now it feels much more personal to the person
Yeah.
practicing. Right?
Yeah, for example, if you're a psychodynamic supervisor and you have a supervisee where you think this skill could be useful for them with a particular patient, you could just assign this exercise out of the book as relates to that patient. And honestly, I mean, this skill, I know is written for psychodynamic psychotherapy, but it applies to many major models of psychotherapy. So like many of the skills in your book, Hannah, I think it can be productively used outside of the context of formal psychodynamic psychotherapy.
Mm-hmm. Yes, absolutely. Right.
We do have to wrap up, folks. If there's any last questions, feel free to ask them in the chat. You can also email us, and we're happy to
I'm putting
field
the
your
link to the
questions.
book on the Zoom chat as well.
Oh, thank you. Here's a link to the book. And here we go. Here's a cleaner link, Alex. Let me
Thank
put
you.
that one had
Yeah,
a
that
bunch of
goes
stuff in it.
You're right.
Here you go. Here's a cleaner link for everyone.
Great.
And please make sure you've signed up for our email list so you can be notified of future. So I'm going to put the website where the email list is there. And we thank you for attending. Thank you for everyone who participated too. We had some really great responses in the chat.
Yeah, let me just say, when I've done these, because now as Alex was mentioning, I have a few of these under my belt. Today's responses, suggestions were just excellent. All of them fit the bill and met the criteria, but also showed a real sensitivity and nuance. So I really appreciate all the participation. It was very enlivening for me. Thank you.
This webinar is made possible by the Sentio Marriage and Family Therapy Program. Visit us at www.sentio.org.